Hello, my name is Ivy. I'm a fourth year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I will be talking about illness anxiety disorder. We'll first look at what illness anxiety disorder is. We'll then look at the risk factors, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Illness anxiety disorder is a mental health condition characterized by extreme worry about having or developing a serious, undiagnosed disease. People with this disorder misinterpret normal bodily sensations, such as sweating, for example, as a serious medical condition. The fear of having an illness persists contrary to normal examinations or test results. There are two types of illness anxiety disorders. The first type being a care-seeking type, in which a person frequently changes their doctor and asks for several tests and treatments. The second is a care avoidant type, in which a person avoids medical care due to an anxiety of discovering a serious medical condition. Illness anxiety disorder typically begins during early adulthood and affects around 0.1% of the United States population. Risk factors. Experts believe that illness anxiety disorder is more common in people who have experienced childhood neglect or abuse, extreme stress, a serious medical condition, or death in the family, growing up in a family that frequently discussed health anxieties, having an anxiety disorder, and spending a lot of time consuming information about diseases on the internet or from television. Symptoms. A person with illness anxiety disorder may excessively worry about having a severe illness, despite the lack of symptoms, or mild symptoms such as an increase in heart rate. Extreme anxiety and hypervigilance about one's health and changes to one's body. Frequent checks of one's body for signs of an illness, such as checking one's blood pressure. Frequent visits to one's doctor, but rejecting their reassurance. Or avoidance of one's doctor due to anxiety about having a serious medical condition. Taking numerous medical tests, often discussing their health with family and friends, avoiding places or people due to the fear about getting an illness, spending a significant amount of time researching symptoms online, and developing work and interpersonal issues because of one's health concerns. Effects. If left untreated, illness anxiety disorder can impede a person's life. The disorder can result in poor performance at school or work, absences from school or work, relationship issues, unneeded and often expensive medical expenses, complications from medical tests and procedures, financial issues due to multiple healthcare visits and medical bills, the development of another mental health condition such as anxiety disorder, major depressive disorder, or a personality disorder. Treatment. A common treatment for illness anxiety disorder is cognitive behavioral therapy, which is a type of psychotherapy that helps people identify and change their unhelpful thoughts, feelings, and behaviors into more productive ones instead. Cognitive behavioral therapy can help people with this disorder reduce their anxiety and change behaviors, such as frequently checking their body and seeking treatment. A medical professional may also prescribe medication to deal with co-occurring conditions such as anxiety disorder or depression, including antidepressants. Coping strategies. To help manage symptoms, a person with illness anxiety disorder can use any of the following coping mechanisms. Track one's symptoms and behaviors related to illness anxiety disorder in a journal or phone. Replace harmful thoughts with healthier ones. Engage in an enjoyable activity such as painting or listening to music to shift one's focus away from maladaptive thoughts and behaviors. Avoid constantly checking harmful information about health that can increase one's anxiety. Practice relaxation, including deep breathing exercises. Avoid alcohol and recreational drugs as they may worsen symptoms. Eat healthy. Exercise regularly. Get adequate sleep. And join a support group for people with this disorder or general anxiety disorders. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forsaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.